a career in animal health care may just be the right fit for you. My name is Lisa Kuntz-Samanuk, and I am the Industry Education Program Facilitator for Chinook School Division in southwestern Saskatchewan. On behalf of Chinook School Division and our partner, the Regina District Industry Education Council, I am pleased to have here with us today Tariq Elnaga, Director of Talent and Brand for Mosaic Veterinary Partners, and Paisley Johnson, Student Ambassador and second-year veterinary medicine student, to share with us about the exciting career options and pathways into working in animal health care. Having Paisley here with us today will provide a unique student perspective on her journey into this field. First, we'll listen to Paisley Johnson, a second-year veterinary student at the Western College of Veterinary Medicine. She is originally from Regina and obtained a Bachelor of Science in Animal Bioscience and a Master's of Science in Large Animal Clinical Sciences from the University of Saskatchewan prior to attending vet school. She has also had a strong passion and love for animals and science, which led her to pursue a career in veterinary medicine. Next, we'll listen to Tariq, who was born and raised a long way from here in Dubai. He is an engineer by education and has an MBA, but fell in love with HR as a career, which he has been doing for over 15 years. Tariq moved to Alberta a little over a decade ago after falling in love with Western sports and culture. No stranger to mixed animal sciences, he has a few horses of his own that he spends a lot of time touring on the rodeo circuit in Alberta. Tariq and Paisley have a wealth of experience to share with us. Their career journeys will be sure to inspire those who are interested in exploring a career in animal health. Following the presentation today, we will have a question and answer period. Feel free to ask them any questions that may help you with making a decision about your future career pathway. We will also share their contact information with you should you choose to contact them directly. Once again, everyone, please join me in welcoming Paisley and Tariq. Take it away, Paisley.
Okay. Sorry about this. Okay, can you see my screen, Lisa?
Yes, we can. Go ahead.
Okay. So good afternoon, everyone. It's awesome to have the opportunity to chat with you guys today about all things veterinary medicine and my journey towards pursuing a career in veterinary medicine. So, as Lisa mentioned, I'm originally from Regina, Saskatchewan, born and raised, and I've always had a really strong passion for animals and a love for animals, and they've always played a really important part of my life and kind of been the center of my life and my activities. So we always had lots of cats and dogs growing up. And when I was young, around the age of 6, I took a particular interest or liking to horses. So I started taking horseback riding lessons, which was a big hit for me. And I really enjoyed that, so much so that I was lucky enough that my parents were on board with buying me my first horse at the age of 12. And so I boarded my horse at a barn outside of Regina and became really involved in the barn community and the equestrian community as a whole, and participated in pony club and 4-H club throughout grade school and high school. And I eventually started showing horses in both the Western and English events. So things like horsemanship, halter, hunter under saddle, things like that. At the local level, and then continued on at the more competitive show level, provincially and nationally. And so my experience and love for horses definitely played an integral role in influencing me towards pursuing a career in veterinary medicine. I knew that I definitely wanted to pursue a career that involved me working with horses hands-on on a day-to-day basis. And I would say another really important experience for me in my childhood that kind of made me realize that I wanted to pursue a career in vet med happened when I was probably 10 years old. So our family dog at the time, Domino, he was only 1 year old, one day we noticed that he started not really acting like himself. He was really lethargic and stopped eating and drinking. So we took him to our local family vet, and they weren't really too sure what was going on with him either. So they referred him to the teaching hospital at the Western College of Veterinary Medicine, where he was diagnosed with two conditions that kind of happened concurrently at the same time. So lung lobe torsion and chylothorax. So lung lobe torsion happens when one of the lung lobes twists on itself and the blood supply is cut off to that specific lobe. And chylothorax, which usually accompanies it, is when the thoracic cavity fills with fluid. So both of these conditions were quite serious, and Domino was going to require surgery to fix for the treatment of these conditions. So he stayed at the vet college for quite a while. I think it was about a month, undergoing surgery and treatment. And my family and I would make the trip back and forth between Regina and Saskatoon so that we could visit him in the intensive care unit. And these visits were really influential for me, just being able to see the inside of the intensive care unit and witness firsthand the veterinary staff, so the veterinarians and the technicians, taking such good care of the animals and doing their best to help them out in whatever way possible, was really inspiring for me. And that was kind of the moment when I realized that veterinary medicine was probably the career for me. And I was lucky because my parents were really good about keeping me involved and in the loop with Domino's treatment, and being able to participate in the decision making around that, and also his care once he came home. So unfortunately, Domino didn't have a good outcome and he wasn't responding to treatment. So eventually we did decide to euthanize him. But I was really grateful for all the veterinary doctors and the technicians again for giving him that chance and trying to save his life. So that was definitely a really influential part of my childhood that turned me towards the career of veterinary medicine. So in high school, at the end of high school, when it came time to decide what type of post-secondary education I wanted to pursue, I decided to pursue a degree in animal bioscience because it aligned closely with my interest for animals as well as science. And I thought it would be a good stepping stone to pursuing a degree in veterinary medicine afterwards. And so this was a really good degree choice for me. It was, like I said, aligned closely with my interests. And in the fourth year of this degree, I was able to participate in a research project with a professor at the veterinary college as part of my course requirements. And so my research project focused on beef cattle and how their different temperaments can impact their stress, which we measured through taking blood samples and measuring cortisol, which is a biomarker for stress in the body, and how this might impact each animal's individual welfare. So before this project, I hadn't really had my sights set too much on research or academia, but I became really interested in this after participating in this research project, and thought that I might actually be kind of interested in pursuing a Master of Science degree in addition to or instead of veterinary medicine, although I still was really interested in vet med at the time. So at the end of fourth year, I was a little bit intimidated by the thought of going directly into veterinary medicine and spending another 4 challenging years in school. So I decided to take a little bit of a break and work for a year. So right after fourth year of undergrad, I worked for 4 months as a research assistant at a swine research barn just outside of Saskatoon. So learning all things about swine production and health was really cool, as I hadn't really had too much experience with pigs before that. And then following that job, I accepted a position with the Government of Saskatchewan Ministry of Agriculture as the Animal Health and Welfare Specialist. So in that role, I was able to work closely with the Chief Veterinary Officer for Saskatchewan, as well as animal welfare and disease surveillance veterinarians, working to improve animal health and welfare in the province of Saskatchewan. And that was a really cool position. And it kind of turned me back onto the path of veterinary medicine once I was able to work with those veterinarians and realize how diverse of a field the profession actually is. So that was a 1-year position. And as it was coming to an end, I was kind of thinking about what I should do next. And I had reached out to a few professors at the vet college and at other universities regarding potentially doing a master's degree in a topic related to animal health. And one of the professors that I reached out to got back to me and said that she had a few master's positions open up. And so I accepted the opportunity to do my master's with her. And the research that I did through my master's was focused on Johne's disease, which is a chronic gastrointestinal disease in beef cattle. And my project looked at comparing the effectiveness of 3 different diagnostic tests for detecting the disease, as well as using a computerized cow herd model to compare different testing strategies and how effective each strategy was. And I really enjoyed doing my master's. It was a really, really great experience, and a great kind of introduction into the world of academia and research. But I still was interested and couldn't get the idea of going to vet school out of my head. So I applied to vet school actually halfway through my master's degree and was accepted. But I was able to defer my start date until the following year so that I could finish my master's degree. And then following the completion of my master's degree, I was able to start vet school. So here I am now in vet school, my second year. And summer after first year vet school was really cool because I was able to work at an equine only practice. So again, just combining my love of horses and veterinary medicine was an awesome experience. This particular clinic was in Elm Creek, Manitoba, and really focused on equine reproduction as well as racetrack and sport horse medicine. I haven't really gone through my pictures, so I'll go through those, but these are 3 of my pets. So on the left here, that's my cat Goatee, and in the center, that's Cairo, and then Mixie, the little Dachshund poodle cross on the right-hand side. And so this picture of me and this little miniature horse was taken at the equine clinic this past summer. His name was Joe, and he lived at the clinic, and so I got to visit with him lots. And then on the left-hand side is me with one of the horses that I showed in high school and at the beginning of undergrad university. And this is a picture that I thought I would include because it was a really exciting moment for me last year in first year. So it was my first surgery. I got to neuter my dog Cairo with one of my favorite professors. So that was a really, really cool experience. And that's just me in a nutshell, kind of sped through that, but I'm happy to, of course, answer any questions about my journey in particular, or just vet school in general, if anyone has any questions.
Thanks, Paisley. I actually have a number of questions for you, actually.
Okay.
So did I hear you right when you said you're a city girl, though, right?
Yes, I'm a city girl.
From the city girl, okay. Because one of my first questions was, what's it been like as a city girl, not a rural girl or a farm girl, going into the field of vet medicine, and then you're with large animals, and you have lots of experience with horses and small animals, but now you're getting into pigs and cows and beef and horses and everything. So what's it been like?
Yeah, that's a really good question. And I think that my undergrad degree in animal bioscience was a really great kind of segue into working with more farm type animals, because I took a lot of animal production courses throughout that degree. And, we visited the poultry barns on campus and the dairy barns, um, and just had lots of exposure to those different aspects of animal production, like nutrition, feed processing, and things like that. And so that definitely um, that definitely helped me out in terms of just a knowledge of different animal production systems. But I would say that it's definitely good to try to get as much hands-on experience with as many different species as possible, so that you're comfortable working with different types of animals and talking to producers. So I volunteered at the poultry research barn on campus so that I could get used to handling poultry and turkeys and things like that. And then, of course, I worked at the swine barn after undergrad. So I got used to handling pigs. And then with cattle, I actually did get to do a bit of hands-on work with my undergraduate research project. So we conducted different temperament assessments on the cattle in our research trial. So running them through the chute, collecting blood, and things like that. So yeah, I would say that it can definitely be intimidating if you don't have experience with large animals or you don't come from a rural farm background, but it's possible to get that experience. And as long as you're passionate and you're willing to learn and learn about as many species as possible, it's definitely doable.
Well, that's good to know. You don't have to be a farm kid. You can get the experience, and there's lots of experiences to have. So that's interesting to hear, because many people would think that unless you're a farm kid, veterinary school is not necessarily something to consider. And it's not necessarily that. Do you happen to know, like, are there stats out there about the number of, city people or town people versus farm kids that actually go into vet medicine? Or maybe Tariq knows that.
Yeah, I don't know the exact stats. I do know that a lot of city folks do apply to vet med with the intent of going into small animal, but then of course you do get a few city people that have more large animal experience, like myself. And then you do get a few farm people with farm backgrounds as well. And they do now have at the WCVM, at least, they have the 5 seats for Saskatchewan students with a large animal background. So they're really trying to attract more people with a farm or large animal background, just due to the shortage of large animal vets in Saskatchewan and Canada.
Absolutely. That's bang on, and to add to that, and that's bang on, Paisley, is ultimately it's a lifestyle choice as to how you want to live after graduation. Do you want to live in an urban or a rural area? You do not have to come, like I've seen both, you do not have to come from a rural area to work in rural practice, and you don't have to come from the city to work in city practice. I would say in terms of percentage, likely depends. So there's only 2 veterinary schools in Western Canada, University of Saskatoon, so WCVM is one of them, and then the University of Calgary is the other. For the University of Calgary, I would say probably the same thing. 5 of the 50 seats in Calgary are rural focused, and have grown up on a ranch or a farm. And the rest come from kind of a variety of backgrounds. And with Saskatoon, just like Paisley said, there's 5 seats dedicated to rural students. Doesn't mean that they couldn't go more than that, but that's kind of 5 dedicated seats. And again, that's to make sure that the rural areas still get some sort of of veterinary graduates. It is tough in terms of finding veterinarians. The school in Calgary right now is going to be doubling its seats in 4 years' time, so it's going to go from 50 seats to 100 seats to somewhat try to address the shortage. It'll make a small dent, but I don't think it'll completely address it, to be honest. But yeah, it ultimately depends on what you want to do at work and also outside of work. How do you want to live? Do you want to live in the city, or do you want to live in a rural area? And I'll talk a little bit more.
Sure, that's good. Yeah, it's interesting to see. It is definitely an industry that's a high demand career and something that kids should consider. Paisley, I know that you have a Bachelor of Science and a Master of Science prior to going to vet school. Is that common, or is there what other ways to education do people have before entering med school?
Yeah, it's definitely not common to have a master's degree. I would say that the majority of people that get accepted to vet school have some sort of undergrad degree. So whether that be a Bachelor of Science or a Bachelor of Arts or some sort of bachelor's degree that's not even related to science or animal science. So but an undergrad degree also isn't a requirement. So there are some people that do get in after 2 years of undergrad. That's the minimum requirement, is 2 years. And some people have 3 years of an undergrad degree. So I would say that the most common is probably people that come in with an undergrad bachelor's degree. But there are a few of us, rare folks that have post bachelor's degree education, like a master's degree.
Okay, good. So you spoke a lot about the research that you've been able to do along the way. How common is it for vet students or vets to do research versus practice? And do some vets do both?
Yeah, I think that I'm not sure exactly how common it is for vets to go into research in academia. I would say that it's not the mainstream path. I would say that most people go on to practice for at least a little bit before coming back to pursue a career in research or academia. And there are certainly professors at the college that do both. So they have a clinical role in the teaching hospital. They do still practice veterinary medicine, but they also do research as well. So yeah, I guess it's just kind of personal preference in terms of what people go on to pursue. Yeah, I would say probably that clinical practice is more common, though most graduates go on to do clinical practice. And then there, of course, is that niche area of research and academia as well.
Good, thanks. A couple more questions. You have a very interesting journey of how your life experiences brought you to this career path. Do you have suggestions for someone in high school who might think that this is a path for them as well?
Yeah, so I would suggest for people that are considering pursuing a career in veterinary medicine to try to get as much experience as early as possible. So I forgot to mention this in my talk previously, but I did start working at a small animal clinic when I was in grade 12, just to get into a vet clinic and start seeing what the profession was all about. So I would definitely recommend doing something like that, whether that be working or even just volunteering a few nights a week at a vet clinic. Is definitely something that won't hurt. And again, like I said, just trying to get as much experience, not necessarily vet experience, but just experience being around and working with a diverse number of species. So horses, maybe volunteering at a local horse barn, just so that you can get around some of those animals and get used to handling them. Same goes for cattle, pigs, poultry, just any type of experience that you can find or you can get. I would say to definitely pursue that. One thing that the veterinary admission committee also really likes to see is volunteer work that's not necessarily animal related. So just thinking of ways that you can volunteer that doesn't necessarily involve animals is also something that I would recommend. In terms of education, you can pursue a wide variety of types of undergrad degrees and still get accepted to vet school. You just need the certain prerequisite courses that the vet college requires in order to apply. But having said that, I really did find that my animal science degree really prepared me for veterinary medicine. And there was definitely some overlap between my undergrad education and the first year of vet school. So just your basic courses like anatomy and physiology and nutrition and things like that. There was quite a bit of crossover between what I learned in undergrad and what I was learning in those first and second year vet school courses. Let's see what else. And yeah, I would just say any opportunity that you come across or that gets thrown your way that you think is interesting or you think might help you pursue a career in vet med, don't hesitate to take it.
Good advice. Good advice. So you've taken lots of opportunities to do research and lots of opportunities to learn about large animals. Can a person be a vet if they just have a preference to work with large animals or just small animals?
Yeah, so definitely a lot of people when they graduate vet school will choose just one or the other. So a lot of people end up choosing to live in a city and just do small animal practice. And then there are some people that will go on to just do cattle and horses or just equine. But in terms of getting accepted into vet school, it would be good to have, even if you're just interested in one or the other, like I said, it's good to have a diverse range of experience in all the species because ultimately they are looking for well-rounded people in terms of their experience with animals. And in vet school, we learn about both small and large animals. So it's a requirement that we take both small and large animal courses and then do both small and large animal rotations in fourth year in the clinic. So ultimately, they like to prepare us to be able to treat everything and anything. But having said that, you can definitely choose once you graduate to go down a more specific path of small or large animal. And of course, you can also choose to specialize further as well in a certain area of practice.
That's good to know. And you know, I think some people may have a comfort level in one area versus the other, but as you've shown, you've gained that comfort over the years and the experiences that you've had an opportunity to become involved in. So that's great. I have one last question for you, and it's is there anything you wish that you would have known before you started this journey?
Is there anything I wish? That's a good question. I think that, you know, when I started my undergrad degree, I wasn't always the most, in high school, I'm trying to think how to word this. I wasn't as focused on school in high school. So when I started pursuing this particular career path in undergrad, I found that it was a really uphill learning curve for me in terms of the courses. Like the courses that you have to take are quite academically demanding. And so this advice probably more so pertains to the academic part of the journey, but I would say, you know, build good study habits early on. So in high school, I would recommend people do that, and also don't be afraid to ask for help and utilize whatever resources you need to help you succeed. There's nothing wrong with attending extracurricular study groups or getting tutors or things like that, because you don't necessarily need to struggle on your own. There's lots of resources that you can use to help you succeed. If you're struggling in some of those harder courses, that's definitely something that I'm passionate about telling younger people. that are interested in pursuing a science or academically challenging degree is just don't be afraid to do whatever you need to do to help you get there, because it is challenging, but it's worth it.
Good to know. And it's such good advice. As a retired educator, I would have given the same advice. So I'm excited to see that you learned over the time the things that teachers have shared with you about, pursuing something that you're passionate about. And I hear you saying in there, you didn't say you were fluid, but you are. You're just kind of flexible and roll with the punches, take the opportunities that are available to you, and get on the journey. And who knows where it'll lead you. So thanks very much for sharing your unique perspective in this journey towards veterinary medicine for you. And I'm excited to see where your career is going to take you. We're going to turn it over now to Tariq Elnaga. He is the Director of Talent Brand for Mosaic Veterinary Partners, and he's going to share more with us about industries and the options that are available. Take it away, Tariq.
Amazing. Thank you so much, Lisa. And thank you so much, Paisley, for an awesome presentation and this opportunity. I'm super excited to be here. Just to confirm, you can see my screen A-okay?
Yes, we can.
Wonderful. Amazing. So I am the Director of Talent and Brand for Mosaic Veterinary Partners, and I'll tell you a little bit about who we are. But what I do is I look after all of our recruiting, whether that's clinical or non-clinical. So that's for veterinarians, vet techs, etc. And I also look after university relations with all major veterinary schools. And that's how we got to meet and got introduced to Paisley, who's been an amazing member of our team. This is such a big opportunity, and I gotta thank you, Lisa, for doing this, because I think this is very forward thinking to be really looking at school students in terms of their interest into the industry. And I can't wait to tell you more about who we are and what we do and what career options do you have within the veterinary world. But I'll also do a kind of a teeny tiny introduction about me and how I came about this. So I've taken a very different route than Paisley. I grew up in Dubai in a house where we never had a cat, a dog, or even a goldfish. If anything, I was absolutely petrified of animals growing up. It was just kind of not a thing that was common in my house, and also just in the way I grew up. But about 10 years ago or so, I went on a trip to Calgary and visited the Calgary Stampede and thought, man, this is the coolest thing I've ever seen, and fell in love with the world of rodeo and equine sports. And then decided, you know what, I'm going to build my life around this. So I moved to Alberta, and I started to learn how to ride, and then eventually bought a horse, ended up buying a couple. This is one of my horses, Larry Bob, who's one of my main competition horses. He's a registered quarter horse and a paint too as well. And I use him for a number of rodeo events that I compete in. Now, because of my love of large animals and being in the sport of rodeo, predominantly around bovine and equine animals, I started in my world of HR, a labor and ranch farm business, or labor business rather, in the farm and ranch world, to supply ranches and farms with crews. And as we did that, we got around things like preg checking days or semen testing days or calving days or so on. And I started working very closely with large animal veterinarians, which through my personal network then led me to an opportunity where I really combined my two loves, which is large animal rural lifestyle, if you will, in the industry, and also HR, which is my corporate background. So we kind of merged the two together. And someone introduced me to Mosaic and said, hey, they need help in terms of recruitment and growing their brand. And I said, man, this is the perfect fit. I get to work, I wouldn't say with animals every day, but around the animal industry and around the animal healthcare industry every single day, and I couldn't be happier. So That's a little bit about me, and a little bit about Mosaic. So Mosaic is a group of veterinary clinics that I'll tell you where their locations are. But what's really cool, and I can tell you this kind of truly speaking from my heart, we've got an incredible team who's very passionate about animal healthcare, and they are truly collaborative. If you look at all of our teams, you'll be working with an incredible group of people who really want the best for our animal patients, and also our human clients. And you know, the way I talk to our students in universities like Paisley is I say we combine the best of both worlds. You get, you know, full clinical independence on how you practice, but then you get a support team to help you with all the things that are non-clinical, like, you know, making your invoices or accounting, or, you know, making sure your IT is all set up or so on. And I'll talk a little bit more about that. But really, Mosaic has a mission and a vision, and they're very clear in terms of what we're trying to do, which is really to build very, very strong partnerships with our clients, very strong partnerships with the communities we're in, and hence why we're here. Again, we were approached saying we'd like a presentation, and very happy doing this because, again, this is important to us to reach out to the communities in which we operate in, and we operate really in multiple locations in Saskatchewan. And then finally, you know, we're here to elevate everybody and everything that we touch, whether that's animal healthcare, whether it's our own team in terms of their education and their knowledge, and the areas and the communities that we operate in for our clinics. Our values are very simple, and I think these are values that are very universal and anybody could relate to them. They're not necessarily clinical values, but they're values that just show who we are and what we mean. So we have 4 core values, and that is connection. So it's building connection with people, building connection with communities. It is tenacity, and that's grit. Is, you know, it's a tough and challenging industry. We're not afraid to face challenges. We're not afraid to try new things, and we're not afraid to really try our best to get the best outcome possible. The third one is growth. So whether that's growth of people, growth of our clinics, growth of our veterinary care, and growth of even the industry, these are things that we're very committed with. And then finally, and this is very, very important, is care. We care about our animal clients and our patients, and also we care about the humans that bring those animals in to us as well. In terms of where we practice, so let's say if you're based across the province of Saskatchewan or in the prairies, here is a picture of where our clinics are at the moment. So we have 4 practices in Saskatchewan, 1 in Regina, 1 in Maple Creek, and 2 in Swift Current, and I'll talk about those in a little bit. And then Mosaic also owns and operates 4 practices in Alberta, predominantly in rural locations in Alberta. Now, Lisa, you had asked a really good question about what kind of a practitioner you can be, and this is kind of a fun little pictogram of all of our clinics and really which animals they serve. So the mix, we're all mixed animal practices, but the mix changes depending on the community and the location. So, for example, where Paisley's from, Regina, our Sherwood Animal Clinic is predominantly focused on equine, but also does small animal work. Whereas, you know, down there or kind of further west towards Alberta and Maple Creek, it is predominantly a bovine clinic. So it looks after a lot of farm and ranch cattle out there, but does a little bit of equine, and then has a small animal feeder there too as well. In Swift Current, we've got 2 clinics that literally share a parking lot. One is exclusively for companion animals and small animals, so it's a pet hospital. And then the one across the street is a large animal practice that looks after both bovine and equine, predominantly bovine, because again, it's big ranching country and beef producer country out there. So the mix changes. If you notice here, our Rocky Rapids, we also have an exotics division in our Rocky Rapids clinics. So we don't just do companion animals, but we also do exotics as well in that clinic. Now, Lisa, you'd asked a really good question is, you know, do I have to specialize or do I have to know? And Paisley answered it really well, is be as exposed as you can to as many types of species as you can. The thing about it is after graduation, we have our veterinarians choose, and they could say, give me whatever walks through the door that morning, and it could be anything. Or we have veterinarians that specialize, so they only do equine in a mixed practice, or they only do bovine in a mixed practice. So we offer the option for both when people are joining us to say, do you want to specialize? And we build that into your contract to say you're going to specialize in only this type of animal, or we could just hire you on as a general mixed practitioner, and it's entirely up to you as to which one you prefer. They, from a pay standpoint, they pay the same. It's really just more what is important for you and for your career, in terms of your growth, and then down the line that will change depending on how you get more senior. But again, ultimately it's a choice of what interests you personally and what's important for you. Now, in veterinary medicine, there's quite a few careers that you could go into. There are clinical ones, and then there are non-clinical ones in the world of veterinary healthcare. And the clinical ones, obviously the one that comes top of mind, and this is the most important one, is to be a doctor of veterinary medicine. So that is our veterinarians. Like Paisley said, there's a varying path into getting into vet med in terms of how many years of education. The typical would be a four-year undergrad and a 4-year veterinary degree, but that's not always the case. Again, it could change, but that's kind of the typical way. And then you could be either a practicing veterinarian, so you work in a clinic or you work in the field treating animals. You could be a research veterinarian, like again, some of the areas that Paisley had mentioned, or you could even be a pharmaceutical veterinarian. So that's looking after drugs, so pharmaceutical products for the veterinary industry. So whether that's sales or research or development in that space. Now, also in the clinic, supporting our veterinarians are two roles, and they're called something different depending on the practice, but give or take, they're about the same. The first one is a registered veterinary technologist. So think of this as, in Europe, they call them veterinary nurses. So what that is they support our veterinarians on all procedures, whether that's surgery or routine procedures or so on, diagnostics. And again, because it is a team effort, and this is offered in multiple technical schools across Western Canada, both in Saskatchewan and in Alberta. It is a registered job, and it is a 2-year degree to complete. It's a very hands-on degree, and again, one that is in big demand as well. And then the other degree offered, and sometimes it's called veterinary assistant, sometimes it's called veterinary receptionist. It's about a 1-year program, also offered in a lot of technical colleges. And that would be things like scheduling appointments, taking in patients, doing initial triage when a case comes into the clinic. And again, they're a very important part of our team because they keep everything running and flowing. And they also look after things like billing, administration, ordering supplies and medication and so on. So a really kind of key part of our team. So usually veterinarians will work very closely with veterinary technologists and veterinary receptionists to work. Now, there is also non-clinical careers where you work around the animal healthcare industry, but you're not necessarily an animal healthcare professional, just like I am. So I'm not a veterinarian. I'm the HR person for the team, but I understand the industry enough that I know when I go talk to candidates who we are and kind of selling the company, if you will, as well. So all clinics across Western Canada require support from non-clinical functions, and that could be things like HR, it could be marketing, so you could be doing social media for veterinary clinics, you could be doing IT, so setting up our IT systems or looking after IT equipment or diagnostic equipment like X-ray machines or ultrasound machines or so on. So we have a technical support team that looks after that. You could be specialized within accounting and finance, or you could even do purchasing. So that's making sure that all of our veterinary clinics have the right supplies, have the right pharmaceuticals, negotiating the best deals on them, and so on. So keep in mind that if you wanted to work in the animal healthcare industry, you could be either a clinician or you could also be a non-clinician in terms of your career. Now, why would you choose a career in veterinary medicine? Again, I think the biggest thing is you love working with animals. Even if you're not a clinician, like I'm not a clinician, I absolutely love working with or around animals. I've fallen in love with them at a later stage in life, but truly kind of drives my passion. You also love working with people because you'll be working with a very strong team and you'll be working with human clients that look to you to say, can you look after my dog or my cat? Very often, an extension of someone's family, or you could look after their performance animals like horses, for example, or you look after ultimately what is their livelihood. So, that's how people make money raising pigs or cattle or sheep or so on. That's how they put food on the table and pay for their mortgages. So you have to have a love of working for people. One of the things that's super cool about working in the veterinary world is no 2 days are the same ever in your career. Every day is different, whether it's the cases you're dealing with or the animals you're working with or the humans you're working with. And you like that diversity of just having every day is a little bit different. And then finally, you want to go home at the end of the day and know that you've made a difference in someone's life, in someone's family, and in someone's community. I think that's really, really important in terms of why you should pursue a career in veterinary medicine. In terms of which area of veterinary medicine, and Lisa, very similar to the question you asked, the first answer is what lifestyle would you want to live? Do you want to live an urban lifestyle or a rural lifestyle, or a little bit of both, where you could be a traveling veterinarian? But ultimately, what do you prefer, and that'll help determine what area of veterinary medicine you're going to be working on. The vast majority of interviews that I do with veterinarians looking to work with Mosaic, I'm not asking them clinical questions because, again, if they've already graduated from school and they're already certified, they know what a spay is or a neuter or a C-section. I'm asking them more cultural questions as to would they like to work in a mixed animal practice in rural Saskatchewan, or do they have a preference on a regional practice? What kind of mentorship do they prefer getting? So I'm asking them really career questions, and based on that, we're able to really put them in the best fit possible and give them a very meaningful career and a very meaningful life. We ask questions as to how they prefer to handle work-life balance and what they like to do outside of work, so that we can really support them that way as well. So the questions aren't just clinical, but it's really who you are as a well-rounded person joining Mosaic. Now, that's really a little bit about Mosaic, a little bit about the careers available within the veterinary world. But with kind of the last little bit here, I'm going to pause, Lisa, and ask for any questions that you might have.
Yeah, I actually have a few for you, actually. Thank
Please.
you for how you clearly communicated the clinical and non-clinical aspect of careers in veterinary medicine. I'm sure that students had not considered all the possibilities. Oftentimes when we talk about careers in veterinary medicine, we just talk about being a doctor, or the technologist. We don't necessarily see the other aspects, and it takes a lot to run a veterinary clinic. So much of veterinary medicine does not involve the animals, but working with the people, the technology, the business side of things, and that. Are there opportunities for students to explore these options as well?
Absolutely. Again, if you're passionate about animals, our accounting and finance team, none of them are veterinarians, but they're passionate about being able to provide accounting and finance services, ultimately for the benefit of our patients, our animal patients. So you could pursue a career that ultimately you say, I want to work within animal healthcare, but you're not specialized in animal healthcare. You could be an accountant. You could be, for example, one of the things that's very important right now in terms of community outreach and really telling people about our clinics is social media and social media branding. And so, especially when it comes to things like small animal clinics, a lot of their reach and their growth comes via social media. So you definitely could explore an area where you do what I will call a more corporate career in the animal healthcare industry rather than just a clinical position.
That's interesting to know. And we want students to, they might have a passion for technology, or they might have a passion for math, accounting, finance, marketing, different things. And to know that you can do that within this industry is good to know. Very,
Absolutely.
very good.
Like we've
I
got
appreciate.
I was going to say we've got a special, like an IT team specialized in things like diagnostic equipment setup and repair. So they set up our X-ray and ultrasound and our patient files and so on. So you could be in IT but working for the veterinary industry.
Yeah, that's interesting to know. I also appreciate your perspective in considering the lifestyle that you want as you decide on the pathway that you'd like to consider. I think that's something that kids often don't consider. They think of a career title like vet. They want to be a vet. They don't think of all of the things involved with that, and that you want to consider the lifestyle. So thanks for
Absolutely.
sharing that.
Absolutely. You're very welcome. And again, for example, if you're a small animal veterinarian in an urban practice, let's say in the city, you have typically fixed hours. You're working from 8 to 4 or 8 to 5, depending on the clinic hours. As soon as you leave the clinic, the grocery stores across the street or restaurants across the street, and you have urban conveniences. Or if you're working in a rural practice, you're typically working both in a clinic and out of a veterinary truck, because a lot of the work that you do is what we call ambulatory. So you're out driving to client ranches, preg checking, 300 cows in a day, and with a crew, obviously. But you're out working in the field. It's a more outdoor job. And then in terms of, city conveniences, you're typically living in a smaller town like Swift Current or Maple Creek. But on the upside, you've got much more accessible housing. It's cheaper to live. If you wanted to live on an acreage or have your own horses in your backyard, these are options for you as a rural veterinarian. Not one is better than the other. Both are great. It just depends on what you personally want.
Right. Thank you for sharing that. What is the best way for students to find out more about these careers? Like, is it to contact you, contact Mosaic Vet Partners or Western College of Vet Med, or like how do students get more information?
Amazing. And that's a great question. So more about the company and who we are, where our website is mosaicvet.com. Reach out to us or to me at any point of time. We'd be happy to answer your question. And then in terms of careers in veterinary medicine, I would say, in Paisley, you're likely a better option, but talk to the recruiting or admissions offices of either veterinary universities, or if you're interested in a college program, veterinary colleges, if you want to become a technologist or a receptionist, in that space, and talk to them about what it would take to apply, what are the academic requirements, how much does it cost, and all those things.
Thank you. I know that careers in veterinary medicine are certainly high in demand. We don't have enough vets, and we need to certainly get more people working in this field. So thank you very much for sharing that. Tariq, I'd like to thank you. It was sure glad that you had the opportunity to go to the Calgary Stampede. What a life-changing event that turned out to be for you. From being a person who's an engineer and in business to then moving to HR and agriculture. I don't know if you're living in a rural, but you're performing a rodeo. Wow.
Thank you. I wouldn't change it for the world. I'm really happy with what I do, and again, very lucky and very blessed. And yeah, I found a passion. It was later in life, but I'm very, very glad I found it.
Well, your journey certainly demonstrates to students how one's skills are transferable, and they help you to pivot, and when an opportunity arises, create that dream career and live your best life. So it was very interesting to hear both of you talk today. Thanks again, Paisley and Tariq. Your spotlight today certainly is going to help students consider a career in veterinary medicine. It maybe is a career that students didn't seem was attainable for them. And it's very interesting to see that it is attainable. Just set your mind to it and go for it.
Wonderful. Thank you very much.
Thanks so much for having me, Lisa.